speaking English or having subtitles. This all really helps because it allows a colloquial, personal approach. We also found that collaborative learning from engaging healthcare professionals, like how their clinics work, a lot of the conditions in England, in terms of the genetic clinics, they'll have the same consultants and they'll run side by side. So a couple of our organizations will attend similar clinics to, let's say, Alstrom would. So how do we collaborate? How do we get them to share pots of money and pool resources, especially for the smaller organizations? So removing the us and them myth. You can't try and engage someone if you immediately are isolating them by saying that they're different to us. That's not how it's going to work. I think if you take it as an approach that this family is the same as us, they were just as scared as us if you would be getting diagnosed with any genetic condition and talking about themselves or their child's health, you have to stop seeing it as it's a separate effort to go and do something like this. It's extending your reach and it's extending your membership. It's extending people using your services. It should be considered as, in fact, a business approach to getting people to engage with the organization. It shouldn't be considered that, oh, it's a separate community, they are away from us. So removing that. Using the learning from BDB to change the core thinking. Now, we hope that through engaging with us, breaking down barriers can help implement systemic change within an organization. That means improving policies, improving their communications, improving how their staff handles things and their in-house cultural competence. So you can't engage a community through the project and then after everything is done, not continue that work. This has to be part of all of your thinking in all the projects that you do going forward. Right. So within the organizations that we fund, we have massive amount of diversity ourselves. So whether that's the communities that we're trying to help our organizations engage, the size, whether they're small, medium, large, their mode of inheritance, whether they're X-linked, dominant, recessive, and also the communities that they're trying to serve. So we try to empower them by helping them have some confidence in communicating sensitive issues, like Kerry mentioned about close blood relative marriage, consanguinity. So we want to reduce barriers to access, service and support for people from ethnic minority. But in order to do this, you need culturally competent professionals. That means professionals who, even if they're not from BAME communities themselves, they have enough knowledge and understanding of barriers that some of the communities face to be able to engage them from a place of empathy and kindness instead of fear of doing something wrong. We believe that obviously education within the services is paramount because, like Kerry said, it's the feeling that parents are left with when you are in a clinic setting that stays with you. That will guide whether you have a good relationship with your clinicians, have a good relationship to then go and seek support from other organisations. I think another thing that we did find is that genetic literacy across the UK tends to be quite low. And especially if you're coming from different faith backgrounds, monotheistic in particular, some people can have really different views about the use of genetics and if that's going to be acceptable within the realms of their faith. So we want to equip professionals to be able to provide adequate and appropriate resources and services, whether that's through the use of chaplains or leaflets or just talking to them that we understand that, these might be some issues that you're struggling with because of your faith, or tell us what's an issue for you within your culture. Right, so here's some tips and tricks. Like I hit on, teaching your staff about different religious and cultural practices. So when they are engaging with families, they can really, have that level of understanding. So whether that's saying Merry Christmas, Happy Eid, Happy Diwali, Happy Hanukkah, and having that extra level of kindness, but doing it in a way that you are teaching other people who aren't from that community, who are members of your organization, about those festivals. So Diwali is the festival of light, Eid tends to happen after the month of fasting in Ramadan. You know, this is what people do. This is what foods they eat, the colors that they wear. So you're spreading awareness, you're spreading education, and you also have a way, a hook of talking with people. Oh, how was your Eid during the pandemic? Did you do something different? What did you struggle with? Oh, diabetes is part of your condition in Alstrom. So does that make things difficult? Because obviously a lot of these festivals are surrounded by amazing desserts and sweets. These are just ways of engagement, and they work. They really do work. So if your staff, they need to have a relationship of trust in the organization where they can feel safe to ask questions. When they don't understand particular aspects of people's, you know, faiths and cultures. So if they wanted to ask about what do people who follow Zoroastrianism believe, and you know, people who are Jehovah's Witnesses in regards with blood donation. So they need to have a culture where questions are able to be asked in a confident and sensitive manner, and there are people in-house being able to answer that, and therefore when they're approaching families, there's that level of understanding and connection. So we found that tailored health communication also works fantastically because it provides new fundraising opportunities. So in England, some of the highest one of the communities that offers the highest donations in the UK is over the month of Ramadan. So that means if you tailor your approach correctly, your health communications via your website and your social media to target particular communities, then you are increasing donation chances, engagement chances, fundraising opportunities. Some of the trusts in England now are now asking, and the funders are asking, are you being inclusive? Are you being diverse? What can you do to better? And it's becoming more of a requirement. So these are all, there's so many benefits to doing this work. Like I mentioned before, with staff diversity, there can be benefits and pitfalls. Sometimes having somebody from the same community can actually, when you're trying to integrate a really tight-knit community, then there can be feelings of, oh, is this person going to be known to our family? Is this person going to talk to other people about us? Or it can be really, really positive where they just feel that level of comfort. So adapting health communications. There are software add-ons called, like there's one example called Browse Aloud, where you just literally have it added onto your website and it automatically flips and turns the website into another language, whether that's French, German, anything. However, we did find that for some of the South Asian languages, this didn't seem to be as accurate because it offered a direct translation of the word, not of its context and meaning, which might not make sense in other languages. As I mentioned, creating videos in other languages and really making the language as simple as possible, removing all medical jargon. I think one great tip to understand is, I don't think most parents care as much as to what's the gene change, how is this happening. I think they care more about how does this affect my children, how does it affect me and my family and future pregnancies and the services that we get given. So removing all the medical jargon, keeping things as simple as possible and being personable and using language that's not too formal, even in other languages, can help with engagement. So might sound like an obvious one, but a lot of our organizations did not have diverse websites. So if you have a picture where it only shows one particular community, let's say the white British community, however, that condition affects multiple communities, the likelihood that those communities are going to engage with the organization is less because they don't see themselves as being relevant or as able to fit in with these organizations if they are not reflected on the website. Making ethnicity prevalence statistics clear on your website is also important for that. So let's say with cystic fibrosis, there's a 1 in 15 carrier status chance for the condition. So making statistics clear, or for connective tissue disorders, South Asians have a higher prevalence for those conditions. Making those really clear can really help engage people. So obviously be respectful, equitable and inclusive, and community champions. So by community champions, that means having people from these communities being like an ambassador for your organization. So they are on the website, they are leading support groups, they are at the forefront of, helping with patient and outreach initiatives. That can be really successful because people want to hear from other parents in their own situation. So the benefits of of diversity. Again, does your organization reflect the community you support? If your answer is no, then what potential barriers does this create to engagement? Most organizations, whilst if they're charitable, they are always focusing on who they can help, but they are also businesses. So this should be considered as an important way of making your business as successful as possible. And if your answers are yes, then are the right questions being asked of your staff and are the right skills being utilized? So we'd really recommend having a skills audit to talk about who has what knowledge and maybe even to discuss different privilege points. So who was raised on free school meals, who went to private schools, who went to state schools, who needed scholarships for their education, who's come from an ethnic minority background within their staff, because all of these upbringing points and factors, or who was raised by a single parent, for example, these are really, really important clinching points of information that help people engage with other people. Because then you can go and speak to that person. You were raised by a single parent, you were raised working class. How can we improve services for these people? And it can be on many different things, especially if you're, let's say, LGBTQ community. You can also ask, how can we engage that community better? What are we missing? So know what you have in-house. We're not asking people to spend more money to do things. We're saying, use what you've got, but use it well. Speak to also people from specific communities who are engaged with your organization. Pick up the phone, let them know who you are, let them have a named person in your organization, build that relationship, because the benefits will just always outweigh, and then they can help guide you on simple things that you can do to improve and potentially what barriers they had. So introducing change management and encouraging permanent systemic change. I hit on this before. Once you start this work, there should be an expectation that this moves up to your management, your senior and your trustee level of thinking, constantly implementing this understanding throughout the work that you do going forward. Right. So I think it is a matter about being honest about what is possible. If you are a really small organization, like I said, utilize what you have in-house, utilize making small changes on your website, and utilize picking up that phone and speaking with people. None of that costs. So do what you can in-house, and also try and pool your resources with other organizations that you're familiar with, because they should also be seeking to do this kind of work. And taking these small achievable steps through your website, media, communications, and your newsletters to go forward with change, but trying hard to monitor the progress for them so you can see, oh my God, this actually worked. We tailored this communication, put it in our newsletter, and we were super successful. So then and that also is a point that you can add in funding applications going forward, that we did this, it really worked, we'd want to do this on a bigger level. So it's always brilliant. If something doesn't work, adjust those goals, try a different technique, contact organizations like ourselves to help guide you. We do also think that once you start getting into this work, looking at your own recruitment practices and seeing how you can diversify your staff, management, trustee will also help getting you the skills that you need within the organization, but also that added plus point of reflecting your service users and having that in-house knowledge. So what can be gained? So increased awareness, a more cohesive community that's going to be multifaceted, diverse and inclusive, key networks, key support networks, not only with health professionals and patients, but patient organizations. You have a deeper connection with families and individuals and an understanding of their needs. More people feel heard and represented, and there's more access to funding opportunities and potentially donations for your organization. We love to say this at BDB. There is more that connects us than divides us. And I think that's all we need to focus on. Whenever you're trying to engage with a family, don't focus on the differences that you have. Focus on the fact that if you're a mother or you are linked with a genetic condition that you are working within the organization of, how scared and terrified those families feel. That's more than enough to connect you with all of these people who are trying to seek help from your organization. So focus on what's there, that's in common instead of what's apart. Thank you so much for listening. These are our contact details. Feel free to get in touch, get involved, add us on social media, and we are really happy to help and support anybody. So please don't be shy. If you have any questions, the floor is back to you, Kerry, Eden.
Well, Carrie and Asia, thank you so much for taking the time and the presentation here today. Just a couple of things that have come in that I wanted to ask, and I know you addressed some of this early on, but for those, some people joined us a little bit later too with it. What was the catalyst behind creating this breaking down of barriers? What was your main driving force? Everybody has a I've had enough. We're just gonna do it. What was yours?
I think it's being a parent and understanding some of the challenges that I went through as a single parent, and coming to terms with a horrendous life-limiting condition for my son. I had to battle services. I think I mentioned this on Tuesday, but battling health, education, social care, benefits system. I had to do all that. And what we really want to make sure as a patient organisation is that we can prevent families from having to go through things like that if we can. So we want to support families through that journey and hopefully make things better. So when I want to be able to support all families affected by, obviously I'm from Alstrom syndrome UK, but as much as we can to spread that to affect, to support all families affected by rare conditions. And to me, there is no difference between family, I want to do that for all families. And so when when we noticed that there are families in the UK that weren't accessing that support and weren't accessing the health services that were available, we just wanted to make every effort that we could to make sure that families had that access, and that we could show that we can help, we can help make a difference and support people through that journey, so that people aren't alone. It's some of the families we meet and some of the stories we hear with some of these horrendous conditions, it's terrible if families aren't, not everybody has a supportive family around them. Not everybody has friends or a community where they are supported, and it can be an incredibly isolating time. So that's why we set up the charity in the first place, to support families. And breaking down barriers really is just making sure that we're reaching as many people as we possibly can, and then sharing that learning with others.
Asia, you want to add anything to your side of this too?
So similarly to Kerry, I have a lot of passion for this field. I wanted to work in genetics since I was 16. My parents are first cousins, and we had a brother who passed away from a genetic condition at the age of 6. And the way my mum was treated by the doctors, the blame that she received, she never sought support because of how she was treated. And that's what was my driving force for going into this field and wanting to do this work, because no one should be made to feel like that. It is all about education, and it is all about making sure the right facts are out there and supporting people to get access to those services, that we can make a change and allow people to make informed choices.
Thank you both for sharing. Interestingly enough, 24 Hours of Rare, our mission was to spread a global message with it. I had a Rare Dads panel the other day, and one of my dads that was on there was from Zimbabwe. And I realize you all are in the UK, but abroad. But he even discussed how rare disease is looked at in his part of the world as even being, some of it even being part of witchcraft, and the gods were frowning on you or your parents and being punished. Do you see, but through your breaking down barriers, do you see a headway in education where everyone is becoming, spreading that word in the education about that, what rare disease is, and that in the rare disease community? Do you all see that happening, or do you still see some of this stigma that is still present?
Shall I take this one, Kerry? So yeah, that is a very common issue that we come across even here. You know, a lot of communities do believe in all those kind of voodoo and black magic practices, and they believe that, you know, when their child has a disfigurement or a genetic condition, that it's because of these things. So that is quite a common ideology that kind of goes across multiple cultures. And it is very, very difficult because every diaspora has their own particular beliefs about this. And it's very, very hard to break that, because often within particular communities, they would seek help and support from their faith leader over their doctor, because they have more trust for their faith leader over their doctor. However, the level of education of that faith leader then obviously does impact. And that's why we would say that in terms of outreach, let's say for Zimbabwe, for example, by going out and having conversations with maybe not the witch doctors themselves, but faith, other leaders within the community, to say, educate them, to say that this is what happens, and you know, this is what happens in other parts of the world, and help them understand the kind of medical knowledge behind it. That does help, but it is very, very difficult. So in the UK, we do a lot of work with different faith organisations, and get the understanding and resources made from the big bodies of faith organisations to produce leaflets for us, and information, and chaplains within hospital for particular religions to get involved. And that can be a massive source of comfort and relief. But yes, it is very common, and those stigmas are very, very hard to address.
I think just to add to that as well, I think, you know, we have quite an active rare disease community in the UK and elsewhere as well. So I think events like this, Rare Disease Day, you know, really raising awareness of rare diseases. And in the UK as well, with the new, you know, developments within genomics, I think as genomics becomes more mainstream and people hear more about genomics, you know, even things like with COVID, you know, as devastating as COVID's been, there is some positives to come out of COVID. And when you have vaccines, you know, how genomics being spread as part of that, looking at the way vaccines have been developed, and you know, the potential that might have on future treatments for rare diseases. You know, the more people hear about this and the more it becomes mainstream, hopefully people will develop that understanding of genetic conditions. But I think, you know, one of the things I remember when I learned that it was a genetic condition, actually I felt that I'd passed that on to my son. I felt so much blame for that. So I think, you know, with that knowledge, there needs to be people in place to be able to support families through that as well, because, you know, in the UK we do have a lack of genetic counsellors, and, you know, at the point of diagnosis isn't always just the time that families need that support. They need that, you know, long term, and that sometimes is where patient organisations can offer that additional support to a family, help them on their journey to develop their knowledge of genetics, to understand it in a way that helps them to come to terms with that, and don't feel blamed for, you know, for genetic conditions within their own family.
Thank you so much. You know, living in the U.S., we have, it's so easy to think that everybody else is just like me, you know, and I think sometimes it's eye-opening for us to hear what goes on in other parts of the world with that. Starting the nonprofit, what role do you really see, though, that industry should be playing? You know, the for-profits, to help in bridging this gap. What can they do? I mean, we have an industry day tomorrow where we're going to have pharma and leaders from industry, what message would you have for them for that?
I mean, I do some consultancy work for pharmaceutical companies, and this is something that we are looking at as well for breaking down barriers, because when we talk about access to healthcare, you know, when we then move on and think about how many from an ethnic minority are involved in clinical trials and accessible are clinical trials for people from an ethnic minority, I think that is another part of our work. One of the things we always look at is, you know, how can we work in partnership with industry? How can patient organisations play a role with industry to help them understand the outcomes that are important to patients? And, you know, patient organisations can work with industry to help them. When you look at the safety communication that they need to share, we can help them to make that into language that's accessible, very similar to the general work that we do in breaking down barriers. But again, you know, with you know, we do a lot of work around patient and public involvement in research and clinical trials, and you know, and those panels, how can we make those panels and that, you know, the engagement more diverse? And so we're considering the needs of all people within a multi-ethnic population, not just a small few that are used to having their voices heard and have the confidence to communicate in these kind of arenas, because it can be quite intimidating working with industry. And you know, we've done a lot of work around looking at, you know, many organizations can have policies around how they can and cannot engage with industry. So I mean, if, you know, we would be open to conversations with any industry representative to look at how we could possibly work together to improve diversity.
Awesome. And then, you know, with COVID has, like you said, there's been some things that have happened with COVID that have caused advancements in medical treatments and accelerated with it. But it's also opened up doors of awareness that people maybe didn't have before. You know, the whole isolation thing, there's a lot of rare disease families that have had to, that was their life. You know, things really didn't change a whole lot for them other than, you know, the world around them changed. But what do you see as with over this last year and the impact? What do you think the future of awareness has? What do you both see with that? And this will be our last question. We'll wrap up. But what do you see the future of awareness being?
I see that there are quite a few positives from COVID in that it's, I think one of the things it's highlighted is the you know, the increased risk of people from BAME communities and the exposure to COVID. And I think one of the things that worries me is, I mean, in the UK, there's been a lot of work from government and health services about looking at the uptake of vaccines within BAME communities. And while on one side, I think that's a positive thing in that they've really looked at the clear messages that they're giving about the vaccine, making sure people can make informed choices. They're looking at initiatives of how they can involve community leaders and mosques in the delivery of the vaccine. However, on the other, also what we don't want to do is for that message to stigmatize the community as well, because we don't want people thinking, oh, there's a certain community that's not going to be taking the vaccines and therefore they're going to be putting other people at risk. So I think it's a very fine balance, but I think, you know, I do think there will be some positives that come from this, and hopefully some increased understanding and some, you know, an increased amount of good practice and look at how health services, government, patients, communities, community leaders all have a role to play in society, really, to make sure all people are protected as much as they can be.
Asia, what are your thoughts?
I think that, you know, again, like what Kerry said, that the COVID's made everything really clear about just the extent of health inequalities that we have across the country. You know, from what I understand about US, you have a similar situation in terms of health inequalities due to kind of private healthcare. And I think, you know, it is going to be about evening and leveling the playing field a little bit. So actually putting money into outreach and education within those areas to uptake, let's say, genetic services. So then it has a counter effect on, you know, people's, you know, informed choices with going forward in genetic counselling, having a better management of their health and conditions, and increasing their quality of life. So I think if you try and level the playing field, it will have an overall kind of equaling of cost, which will then help improve quality of life and reduce the stress on healthcare services if people have a better understanding of their health in general. In UK, they're opening like 20 genomic centres across the country to try and use genetics to become a forefront for preventative medicine. And that's going to probably in the next 10 years change the landscape of how we do and see things. And so I do think genetics is the future. I do think genetic awareness is the way to go. That's going to improve things for a lot of people across the country. So yeah, I think that a lot of the advice that we were given today, even though we've used it as an example for pilots in UK, these can be adapted to multiple organizations globally, I hope.
I think that is the hope. And I think, you know, the whole, the underlying theme, I think that there is this incredible desire. And I have, you know, when we did the 24 hours of rare straight through, we talked to people all over the world. And there is this desire to collaborate and in trying to bring things together. And I really appreciate what you are doing and your mission toward trying to break down those barriers so that people can come and they can get help. I mean, that's what we're after, is just to help the individuals. Thank you both. And talking about bringing down barriers and discussing these topics and bringing them out. You know, Carrie, it was great to see you. Asia, thank you for joining us today. Ladies, we really appreciate your time and what you're doing, contributing to 24 hours of rare. Thank you so much.
Oh, thank you. And congratulations on putting this event together. Thank you.
Thank you. Wouldn't be possible
Well done,
like you. That's what we always say. All right, well, coming up at the 11 o'clock hour, we have another panel that is going to be kicking off with what are the ethical pre-approval considerations for rare patient groups. Please join us.